I suppose, Professor Drumm, that brings us to the whole perception of the HSE, and you get a lot of criticism in the press, rightly or wrongly. People's perception is that the HSE is too bureaucratic. It's full of people who shouldn't be paid the kind of salaries that they are in there, and that you're not doing your job properly. That must be very hurtful for you to have. In your view, you're going ahead, you're ploughing ahead with the great vision for the HSE in this country of the future in healthcare, and yet you're being criticised. How does that make you feel?
Well, I think first of all, you wouldn't do this job, Karen, if sensitivity was your top priority. But or if that's what you actually the way you grew up. But personal challenges are always huge. Not so much for me, but at a family level, they're obviously a big issue. I mean, when you have children out there in a school environment, and indeed you have a family and that sort of stuff, clearly that can have its effect. And I do believe some of that is unfair. I mean, I'm not an elected politician, etc. But
that your children get criticised, is it?
Well,
or they get targeted?
On the street. I mean, I walk the streets. I have to deal with that. People want to give their opinion. So I do think sometimes, that is a huge challenge to the job. But you don't come into this unless you come into it with a view that you're going to change things for the good for people. You don't come in. Most people didn't come into medicine without wishing to change things. And the bottom line here is, it comes with the territory. It is difficult, but you have to keep the higher vision. And it's sort of in your own question. People put it to me all the time. Why aren't we just focused on sorting the firefight that happened yesterday? That's what's been done in the Irish health system for 50 years. You can fix A&E for 6 months. You can actually fix it for a year or two. I could have it's resolved very quickly for a year or two. It's just going to come back. If we didn't keep a view to the vision, and I can guarantee you that we set a plan for each year of what we wanted to achieve, and I can guarantee you we're achieving it, and I can guarantee you that at the end of a 5-year period, you'll have seen seismic change, and nowhere more will you have seen that than in what's written in the papers in terms of the criticism, which will have moved on from thousands of more beds that haven't forgotten that issue, and now criticising the failure to deliver primary care teams. That's good. That means now the idea has been taken on board.
But how do you deal with it on a personal level, Professor Drumm, having to absorb that amount of criticism and in your view, perhaps not getting the praise that you feel you and your team deserve?
No, I don't think we're looking for praise. At least I would have told anybody who came into this with me that this isn't about praise. I mean, look, you hear things going out. Like somebody went out on the media or whatever on one of these programmes a few months ago saying like 45% of the people who work in the health service are administrators. Now, they neglected to actually say that included all home helps, all domestic staff in the hospitals, all cleaning staff, all nursing aides, and that actually made up 38 to 45%. So people, will play with figures, and you just can't respond to every one of them. You accept that we have a huge amount to fix. You accept that you keep focused on the bigger picture. And you accept that everything is not perfect and we'd like it to be better, as it is in every health system in the world. But the most important thing to accept, Karen, I think, is nobody is ever going to praise you for fixing something like this, because people don't notice the change. The change occurs gradually. It evolves. And, maybe if somebody writes a history 20 years down the line, they may see that change. But I never expected people to turn around and say that this was, because there's too many vested interests.
But so how do you, everybody, we're all human beings, so, we all want recognition for whatever it is, whether we're minding kids or we're running a bank or we're running the health service. How do you personally find a way to deal with that, that level of criticism?
First of all, you couldn't do it unless you had people around you at a family level who were completely and totally willing to accept that. That's probably one of the biggest challenges. You've almost sometimes to make it quite laugh and make a joke out of it. But I mean, if your family went offside on that and began to really not see the vision with you, then, to be honest with you, this job is probably undoable for any individual. There probably is no job that is more day to day in that limelight. So it's a huge issue. I mean, for me to go into a restaurant and sit in a corner, I may end up having to take opinions all night.
That happens regularly, does it?
Well, it does happen, and what you do is you pick places where people will, know you, and because you go all the time, it doesn't give you much variation in your life. So there's no doubt the demands are huge there, but for me, and I think for my family, who would be, would know what this vision is from my perspective, and perhaps more importantly, there was a group of people there. When people talk about people being overpaid, there's a group of people there who I wouldn't even have known coming to this organisation. There's a group of people there, for instance, at the senior management level who get all this abuse. I have people across the areas of this country who are paid 100 or 120,000 euro a year, who work 18 hours a day and often will work for me 6 or 7 days a week because they see the vision and they want to deliver. What is actually ultimately important is, from my own perspective, and I suspect from those people's perspective, is that waiting lists disappear, that people have easy access to our services, and that people experience something that's way better than what they experienced in the past. So in essence, things like outpatient waiting lists, which was a great scandal, never measured until we ourselves began to measure them, we will see them got rid of over the next couple of years, already dramatically improving.
And what about just on that whole issue about the number of administrative staff within the HSE who some people believe are completely irrelevant to the structure of the HSE? Is it 3,000? Is it 10,000? No. Are they on salaries of, 100,000, 150,000? Can you just give us a sense, Professor Drumm, of where the truth is in all of that?
I think I can have a reasonable shot at that, Karen, which is, first of all, say on the figures I can be quite accurate. In terms of backroom functions for the HSE, you are talking about 4,200 people, and those are the people who run the finance processes, the HR processes, and for an organisation of over 100,000 people, it's probably not out of line with anything in the world, but I think we can improve on that. If people want to then start counting, we have a total, in quotations, administrative staff of 17,000. The rest of that 17,000, the other 13,000, are the secretaries, the consultants, the people you meet when you walk into a hospital. Now, if people want to keep throwing that figure around and take them all out, ironically, you see people writing on the paper, some of them clinicians, saying, why not get rid of all these people? Well, I can tell you, if some of those people who are writing that, who are senior clinicians on the paper, if I move to take out their administrative staff tomorrow, you'd see one hell of a battle.
But you have people like Professor Cron, for example, who's been very vocal in his criticism of the HSE, of you and of Mary Harney in particular, saying that, the number of senior administrative staff has grown enormously. I think his figure may be something like 800% over the last number of years.
And that's absolutely untrue. I mean, absolutely untrue. The HSE administrative staff has not grown at all in backroom functions. Where it has grown to some small degree is every time we put in a new service with new consultants, and I think Professor Crown would accept this as well as everybody else. If we don't put in administrative staff beside them, we may as well forget it. So this is simplistic stuff. There are easy figures to throw at the system. We can all sit there, I could sit there, and I'm sure I'd have massive criticisms looking at the system from the outside. The bottom line is, some people have to get in, roll up their sleeves and try and fix the system. Is the system perfect? It is not. Is there any other system? I worked in the Canadian system for nearly 10 years. Is it perfect? And I still have loads of contact. It is not. I know the Australian system very well. There are huge problems because they're all disintegrated. People out in the community disintegrated from the hospital system. I believe following the course we're following, and if you want to go to Rings End or you want to go to Pierce Street where the new primary care teams are, what we put in place there is best in the world, and there'll be others coming to look at it.